Welcome back to my podcast, The Reality of Plastic Surgery. In this episode, I will be talking about breast reduction, specifically, who is a good candidate for breast reduction. Breast reduction is an operation which is performed to make the breast size smaller. Due to some reasons, which could be physiological or for some unknown reasons, the breast size becomes big. This can start affecting a patient's life. It can be it can lead to pain in the neck. It can give pain in the back. It starts affecting the dresses. Even you can get shoulder straps from the increased weight of the bra. Sometimes patient gets rash under the breast, and that can lead to infections at time. So the overall, it starts affecting your dressing. It starts affecting exercise and day-to-day activities. For these cases, breast reduction is an operation. This operation is performed under general anesthetic, and the aim is to make the breast size smaller. It's a very common question in the consultation that how much smaller can you go? Normally, we do not go smaller based on cup sizes. The operation is performed based on the patient's uh, breast base. That means the profile, how wide their chest is, how wide the breast base is. And we have to mark, making sure that we maintain the blood supply to the nipple areola complex. So we have to keep some breast tissue to preserve the blood supply. With careful marking before the operation, we end up getting a breast size which is proportionate to your frame. And that's what a good breast reduction surgery should be. Now, who is somebody who will not benefit from this operation? So this operation should not be confused or mixed up with a breast uplift operation. So if somebody is looking for a simple uplift operation, then breast reduction is not the right operation for you. Or if somebody is keen to maintain the overall breast size, then this is not the right operation. There are different operations which I will be discussing in further podcast, which is called an uplift or a mastopexy procedure. When you see a plastic surgeon for a breast reduction operation, what does your consultation involve? The plastic surgeon should go through a detailed history. He should talk to you, try to understand what the issues are, what are the problems you are getting with increased breast size. He will be going into details of any previous breast operations, any history of any lumps, any nipple discharge, any skin changes you have noticed. He or she will be discussing with you any previous family history of breast cancer or ovarian cancer or endometrial cancer. Then there will be detailed discussion of medical conditions, all the medications, if any allergies, smoking habits. The consultation should discuss in detail your activities like driving, your exercise, your work. So that will help you to plan the operation, the recovery, and the downtime. Following these, there should be a detailed examination of the normal breast, a detailed oncological examination, and there should be assessment of the measurements. So the measurements should be recorded to say what is the position of the nipple areola complex and how much is the excess skin laxity. So after the detailed history and examination, your surgeon will discuss what operation you will benefit from. And there are different techniques to do a breast reduction procedure. Your surgeon will explain to you what are the different techniques available and you would benefit from which technique. The surgeon should also explain what results to expect, what would be the nipple position, how much of skin is going away, how much of breast tissue is being taken out. Then there should be a detailed discussion about the operation, the healing, the recovery, whether there will be any drains in the need for pressure garments. After this, you should have detailed discussion of all the risks and complications associated with the procedure. Your surgeon should explain all the possible risks and complications, including risk of infection, bleeding. You will have a scar, which will be around the new nipple areola complex and inverted anchor. Most commonly, these are the scars. Some risk of bone breakdowns. The scars can get lumpy. The nipple sensation can go away. This operation can affect future breastfeeding. There is a chance that there could be some asymmetry after the operation. You can get some lumps inside the breast, which is common after this operation, and those lumps can settle down. There are some anesthetic risks you should be aware of, including risk of getting clots in legs and lungs. And at the present time, there is a risk of catching COVID infection in post-operative period. So after these discussions, your surgeon should provide you a leaflet with all these information to take home so that you can read in detail about all these operations and the risks and complications, and that should help you to make a well-informed decision. You should always go back and see the surgeon again for a second consultation, ideally after a cooling off period of 2 weeks. So in the second consultation, you can again discuss the operations, your risks and complications, to give you a better understanding what you are going for. For more information, please visit my website, and which has a page for breast reduction, and you can read. If you have any questions, feel free to get in touch with my secretary.